your vagina can actually close up. And I'm not just saying this for clickbait, because medically this is actually a thing, and I see it in young little bitty babies, and I see it in much older women, but it can happen to just about anybody if the conditions are right. Hi, I'm your local OBGYN. I love women, and let's talk about it. So you have these labia, okay? You know, those like things that are outside of your vagina that are kind of like the doors, the entryway to everything getting in. And we talk and talk and talk about how everything is very hormonally dependent. But what you don't realize is that part of what estrogen does to the labia is it keeps it healthy, it keeps it moisturized, it keeps it lubricated enough that there are two separate labia. So like they're kind of like this instead of like this, like stuck together. I'm doing a really crappy job of describing this, but what you need to realize is when you get super low in estrogen, you can actually see those labia start to fuse down, mostly from the top to the bottom. And what women might describe is that their pee is taking a different trajectory, kind of like going at a different angle, or they find that the opening has closed a little bit, and it's basically like the labia glue themselves together, and we call it labial agglutination. The reason we'll see this in babies is that babies, when they're born, might have some leftover estrogen that came to them from their mom via the placenta, but once they're born, they go back to like bupkis because, you know, like they don't need estrogen yet. And sometimes their labia confused together. And then in older age, it can happen again where we see this fuse as well. So what I'll tell you is that if this is something that happens, usually what we'll do is a little bit of pressure, a little bit of estrogen, and pull it out to the side. Very rarely does somebody need something more like a surgical intervention to whoosh, open it back up.